Hello friends, my name is Keisha, and I'm a proud member of the Métis Nation of Saskatchewan. I'm also a survivor of human trafficking. My trafficking began in Canada and crossed into the United States. I was stalked, hunted, and ignored by the very systems that were meant to protect me. This is why, with my father, Dale Richardson, we started the CARES Project, an Indigenous survivor-led movement for humanity. We are dedicated to exposing human trafficking, government corruption, and holding institutions accountable. The judicial branch is broken. It has failed to restrain the evils that have come upon this republic. Whether it's family court failures, weaponization of the judiciary, COVID-era harms, or human trafficking, the courts have allowed these issues to continue unchecked for too long. One of the most powerful tools we're using is the petition for redress of grievances. These are lawful constitutional actions rooted in the founding principles of this country. On May 19, 2026, a formal petition for redress of grievances was submitted to the United States Congress. This petition is demanding that Congress and the President use the powers under Article 4, Section 4 to preserve this Republican form of government by restraining these abuses pending congressional investigation. Through the CARES Project Action Plan, we are mobilizing people across the United States to strengthen this effort. This petition has been created as a template. If you or someone you love have been hurt by these same systemic failures in the courts or by government institutions, your evidence matters. When you come forward, please bring your evidence along with a copy of the petition for redress of grievances. This helps connect your story to this growing constitutional record being placed before Congress. We are asking you to stand with us. Join the CARES Project Action Plan and help us build a precedent that demands accountability and protects the God-given rights of American families. Our united voices will compel Congress to uphold the Constitution and safeguard our liberties. United we stand, one nation under God. I will close with my favorite quote. The greatest want of the world is the want of men. Men who will not be bought or sold. Men who in their inmost souls are true and honest. Men who do not fear to call sin by its right name. Men whose conscience is as true to duty as the needle to the pole. Men who will stand for the right, though the heavens may fall. Thank you.
Welcome to the CARES Project podcast. Today we have with us Dr. I'm going to mess up your last name, Ron Elfenbein.
You got it. You nailed it. You
Okay.
nailed it. Yeah.
All right. So,
Nicely done.
all right. So I didn't stick my foot in my mouth. Good one.
No,
Um,
sir. No,
s-
sir.
so you were a doctor that were dealing with the monoclonal antibodies during COVID, and you were completely, attacked by the judicial branch. The U.S. attorneys came after you for some type of what they called fraud, which was clearly not fraud. But you want to kind of get into that and introduce yourself to our audience?
Sure. So yeah, I'm an emergency room doctor. I trained at Johns Hopkins, and as you said, during COVID, I was very, very active, and I actually owned an urgent care center, and we became the largest supplier of monoclonal antibodies in the entire state of Maryland. We surpassed Johns Hopkins. We surpassed the University of Maryland. We had, believe at one point, three sites where we were administering monoclonal antibodies. And for those of you that don't know, for your listeners that don't know, monoclonal antibodies were the essentially the cure for COVID. They were basically an antibody that um, is an antibody is what your body produces to fight an infection. And monoclonal means one clone. So essentially, they take the most efficacious antibody, the best antibody they can find that works against the virus. In this case, it was COVID-19, but whatever you're talking about. In this case, again, it was COVID, but monoclonal antibodies have been used to treat lots and lots and lots of things since the 70s, actually, all the way things from cancer to autoimmune diseases to other infectious diseases. So this is not a new technology. But so anyway, so they take the one antibody and they clone it a gazillion times. and you have a little, it comes in a little powder. You mix it with some saline, and you drip it into an IV into your arm over about 30 minutes and or an hour, and you're basically cured of your disease. So it was truly the cure for COVID. And I've never seen anything like it in my entire career as a doctor, how wonderful this stuff was. So I found that initially, when they first talked about it, I read the data, I read the reports, and I started to do my own investigation. And I thought this stuff is amazing. So I found out how to do it myself. And because as an emergency room doctor, I don't really know much about infusing people. You have a heart attack, you have a stroke, you get stabbed, you get shot, you get run over by a car, whatever. I'm your guy, but I don't know how to run an infusion center. So I had to learn all about that. And so I really taught myself. I had to go online and do a whole bunch of research about everything about how to do it. And we opened up one site, and we very, very quickly overwhelmed that site with patients that needed this drug. And the government made it very, very difficult for people to get it. So I said, well, this is crazy. Why are they making it so hard for people to get? We should make it easy for people to get. So that's what we did. And then we opened up a second site. And then actually HHS, the federal government, the United States federal government, reached out to me and asked me to open up a site at FedEx Field where the Washington Redskins play football. So in partnership with HHS, and the Maryland Department of Health and my company, we formed a partnership, and we opened up the site at FedEx Field. And the way we did it there became the national blueprint for the entire country going forward for all monoclonal antibodies for all the infusion centers. And I was on the news. I was on Fox News and CBS and Breitbart and NBC and ABC, and you name it, I was on it during COVID. And I was talking about COVID in general, but then I started talking about how wonderful these monoclonal antibodies were and how these things would cure people and really were the cure for this disease. And I started to question the vaccine narrative. I started to say, well, why are we pushing only this one thing when we have a cure? Like, why are we only going down this one road when we have this alternative medicine that has been studied and has been around since the 70s versus the vaccines, which were brand new, had never been tested, and hadn't been proven, but that's all they were pushing. And I said, this doesn't make any sense.
Yes.
So, what's that?
I said yes. I agree.
I mean, it really didn't make any sense from any standpoint, certainly not a medical standpoint. And then the administration, the government, the Biden administration started to do something very curious. They started to federalize the distribution of the medication. So they said, we, the federal government, are now going to control the distribution of this medicine. And before they did that, the way it worked was the states would authorize you as a service provider. So I had to apply through the state of Maryland to get a PIN number to be a distributor for monoclonal antibodies, or a provider for monoclonal antibodies. And they came out and inspected, made sure we were doing things appropriately, and they gave us a PIN number. And then you'd log into the distributor's website once a week, and you would order whatever medication you wanted, however much you needed. And the next day, you literally would get a care package on ice of whatever you asked for. And then when the Fed said, well, we're going to control it, all of a sudden that number got pretty much cut in half. So you'd ask for 100 doses, you're lucky if you got 50. And certain states got cut off completely, and they just so happened to be red states. And I started talking about that on the news because I thought that was wrong.
So the federal
And
government began to restrict the
yes, yes, they started to restrict it to certain states. They said we're going to control it. And then at first they didn't say what criteria they were using. They just said we're going to just stop. We're just going to control it, and we're going to people noticed that they weren't getting it anymore. And if you remember, Florida at the time was Ron DeSantis, the governor, was very, very pro monoclonal antibodies, so much so that he actually was creating like vans that would drive around and give people monoclonal antibodies because he recognized how wonderful this stuff was too. And guess what? The government cut Florida off. And it's kind of awful what they did because Florida has the most at-risk population of all the states in the country. And the highest risk because they're old and they have a lot of
yes,
medical problems. And
yes.
there was a Delta outbreak at the time, and they basically consigned all these people to die. So DeSantis wasn't going to let that happen. So he went to the drug manufacturers himself with Floridian taxpayer dollars and said, I will buy them myself, which the federal government then said is illegal. You can't do it. But he did it anyway. So they really tried to make it incredibly hard for him to go out and do that. And meanwhile, I'm sitting here watching and I'm like, what the hell is going on? and my numbers got cut in half. We still had hundreds and hundreds and hundreds of people every week trying to get infused. And luckily, we had built up a little bit of a supply, so we had a little bit of a cushion, but not much. And then the government finally admitted what they were using as criteria. They said, "Oh, well, we're using equity as a means to determine who's going to get this medicine and who's not." And I went on the news and I was like, first of all, nobody's ever been able to explain to me what that term means. I don't have a definition for equity, but I can tell you that it certainly has no place in a medical discussion. Okay. That should
Yes.
be between the doctor and the provider and the patient, and that's it. Nobody else should be involved in that discussion. Yet the
No.
government decided to insert itself and said, well, equity has to be a factor now, which again, I've never heard of anything being done like this in the history of medicine. And then to make it even worse, at the end of December of 2021, the feds came out and said, well, we're going to shut the whole program down because we believe that there's an Omicron surge going on, and Omicron had reached a tipping point where the medicines wouldn't work against Omicron. And they said that the prevalence of Omicron was 70%, and that was the tipping point. And they said, we're just going to cut the program off. So I went on Fox News and I went on Newsmax, and here's the article from Fox News where
Yes.
I basically said, it says Maryland doctor says people are, quote, going to die, which is exactly what I said, after Biden administration uses faulty data to snub antibody treatments. And I went on there and I said, first of all, these people don't know what they're doing. Second of all, we don't know what the prevalence is. Third of all, we don't know if this medicine will work or not against Omicron. I haven't seen any data to suggest that it won't, but yet the government declares it's not going to work based on what nobody seems to know. And
Yes.
and I said they've never been right about anything.
No.
So
No.
uh, nothing, zero. They were right about zero when it came to everything about the pandemic. Um, so I went on there and I said they're going to kill people, and then Newsmax called me and said, "Oh, can you come on and talk about your article?" And I went on like 2 or 3 days later, and again, same thing. I was so angry because we had to cancel hundreds and hundreds and hundreds of people who needed these infusions, and I can tell you that a certain percentage of people throughout the country, and it's not a small percentage, who were going to get infused, who couldn't get infused, either died or needed to be hospitalized because of the stupidity of these people. Now, that's unconscionable, and that's wrong, and that's evil. But that's exactly what they did. So, 4 months later, almost to the day that I went on Fox News and talked to them, I find myself indicted on federal healthcare fraud charges. And even the federal judge adjudicating my case in a pretrial conference said, this is a case of, quote, shoot first and ask questions later, end quote, because no real investigation had been done. They got my name wrong on all the documents just to show you like how pathetic their quote unquote investigation was.
Yes.
And, they come after me for these charges that were just ridiculous and bogus. And 4 months later, after I speak out publicly about this. So the timing is pretty obvious, in my opinion, makes it pretty clear what they were doing. They were trying to shut me up because here I was bad mouthing them. And I'm sorry. Also, I didn't know this at the time, but I've subsequently learned, I kind of suspected it, but Secretary Kennedy has spoken multiple times about the fact that if there is an emergency use authorization for a vaccine, if anything is proven to be efficacious against whatever that vaccine is targeting, in this case it was COVID
they
19.
can't. They can't use it.
The any other medicines? What's that?
They can't issue that emergency use because they've got another treatment.
Exactly. The EUA is lost. So that's why, in his opinion, they had to squash ivermectin and hydroxychloroquine. And I would argue that monoclonal antibodies were even more efficacious than those two medicines because, first of all, we had data on monoclonals. We didn't really have data on hydroxychloroquine or ivermectin. And second of all, the monoclonals is one and done. You literally 30 minutes to an hour, you get an IV infusion and you are done and you are cured. So they had to squash it. And just so happens that after I went on the news, they indicted me, and a few months later, all the monoclonal antibodies were taken off the market, and
You
you
know,
cannot get them anymore.
this is actually. It's funny in the sense that I've watched this type of thing happen before. It's not funny that they're actually doing it, but I mean, like for me, I'm a mechanical engineering technologist, and I whistle blew the engineering controls because I saw what they brought out here in Canada. They got it from the CDC, and it was wrong. It was dead wrong. And I watched what
Yep.
they did. I watched what OSHA did, what they did here for OH&S, which is the Canadian equivalent, and they did it wrong.
Hmm.
So for me, when I'm thinking to myself, I'm like, you have an aerosolized pathogen. Engineering controls reduces the spread by up to 80%. So if you do this wrong, and then I watched everything that they did after that, like the masking, they what they did with the treatment, what you're talking about here, it's like they wanted people to get sick, and then they're like, oh, here, by the way, here's this vaccine. And then I was talking to somebody about what they were talking about the sequencing with the spike protein and all that stuff, and it was like, this is insane. Like, why would you do this? Why would you do this? Why would you take the tax dollars to get people sick and then punish people who are trying to keep people healthy?
Yeah, it's a great question, and I think the answer is pretty clear when you look at exactly the way you framed it. And the same thing with my case, and we can get into the details of it, but they basically charged me with 5 counts of healthcare fraud. And truthfully, the explanation of they said we were upcoding, meaning we were using the wrong code, okay, the billing code. That argument, and we'll get into it in a minute, but makes no sense. It really doesn't. What makes sense is the alternative, which is I was a threat to the EUA for the vaccine, and I was obnoxious, and I was loud, and I was the largest provider of this life-saving medication in the entire state of Maryland, and to my knowledge, the entire Mid-Atlantic region of the United States, which includes Pennsylvania, Delaware, Virginia, West Virginia, and Maryland. So that's a pretty big chunk of the East Coast, and we were getting people from New Jersey. Somebody drove down from Vermont to get monoclonal antibodies at one of my sites because they couldn't get it where they were. So we were big and we were doing a lot of good, and I think the way they saw it, they had to shut me up and they had to shut me down. So I think to put this into perspective, like so people understand, you think about fraud and you think about healthcare fraud. What does that involve? Well, typically fraud from the government's perspective involves billing for things that don't actually happen. Okay. Like you see all in the United States now in Minnesota and in California, they're
Yes,
building this train, this train. Not a single track has been laid. And yet $6 billion or some ridiculous number has is disappeared. That's clear fraud, right? I mean, things that are being billed for that don't actually occur. Well, they charged me with 5 counts of healthcare fraud, which are 5 individual patients. And by the way, just to lay this out, that carries a 50-year sentence in jail and millions of dollars in restitution. 50 years.
yes.
And truly, what this really boils down to at its worst is a billing dispute over 5 charts. Each chart is about worth about $50 in terms of the billing dispute. So you're talking about 50 years in jail for a $250 billing dispute. Like in what universe, galaxy, whatever, does that make any sense?
I
But
don't.
just so you understand, well, right. I mean, because it doesn't make sense. That's my point. These are the patient charts. Okay, their names have been redacted, but they're right here in my hands. These are real people. These patients existed. They all got seen. In fact, the government, I don't understand why, but they called 3 of them at trial, and they raised their right hand and they said, "Yes, I swear to God that I'm a real person. I got seen. I got tested. I got my vital signs taken. All the rest of that stuff that we said we did. Where's the fraud?
I
Like these are real human beings."
I was looking over some of your court documents as well, and I couldn't understand the case that the government was trying to make that in a rational manner. Like, because if justice is done, a person should be able to come back and look at what was done and understand why they came to that conclusion. And
Right.
this, then again, like when you sit down and look at the way that what the how the people, like how a jury convicted you, I don't understand. I do not understand how that happened.
Well, I think I do, and I'll get that in a second because I think I do. But so they said we were upcoding, and by the way, there are over 69,000 codes that we use in the ICD-10 lexicon, and the government said that we chose 5 charts that we wrongly coded them. Okay, and as I said before, We were billing what's called a level 4 billing. It doesn't matter. I don't have to get into all the details, but we had a very reasonable, rational reason for doing that. And by the way, I didn't see a single one of these patients. Okay, we had nurse practitioners and PAs seeing them. I didn't see them.
Let me ask you a question. How many people did you see over all that, like over that period of time?
So the period of the indictment, we saw over 100,000, and throughout the entire pandemic, we saw over 300,000. And the government chose five. Five. That's all they did. And by the way, Dale, I know, right? It's laughable, right? It is completely laughable, but it's not because it's so serious.
Yes.
But I get it, and I feel the same way you do. I mean, I feel free to laugh. It's okay. I'm not mad. I agree with you. Like you have to laugh because it's so ridiculous. So they look at five charts. Now, they never even had a professional coder, okay, look at these five charts, just government attorneys.
Yes.
And as I said, I didn't see a single one of these patients. We had nurse practitioners and PAs who saw them, who charted on them, and who did their billing and coding, not me. And then we have a third party company outside of our company who did the billing and coding just to make sure things were done properly. None of those people got indicted. None of those people got investigated. So, again, I didn't see any of these people. I didn't bill any of these people. It was on the medical director, but I wasn't there physically seeing these people. Now, as I said before, we billed a level 4. The government alleged that that was wrong. They never said why it was wrong, how it was wrong, or what the right billing should have been. They just said, they kept pointing their finger at me and saying, you're wrong and you're a criminal. But they
Th-
never said how or why.
that, but th-
It's crazy.
this is the point that you just made here. The prosecution has to bring their case. The onus is on them to prove beyond a
Yes,
reasonable
yes.
doubt that you did something wrong. But the fact is like, no, it's up to you. This is what you see when you find weaponization. It's like you're guilty and you have to prove yourself innocent because I said so, and this happens all the time.
Absolutely, 100%. And yes, it happens way too often, and these people get away with it. And luckily, they didn't in my case, and I'll get to that in a second. But you asked a very good question earlier. You said something earlier. How did the jury convict me? So I took this to trial again because I did nothing wrong, and this is insane. And I kept thinking, they have no evidence. I haven't done anything wrong. What are they going to? How are they going to prove this? And every single thing that they threw up there got destroyed. Every one of their. So first they said, well, you weren't spending enough time with your patients. And again, I wasn't seeing these people, but they said you weren't spending enough time to justify the billing that you were doing. That was in my indictment. They indicted me. Two things were listed in the indictment. You're not spending enough time with your patients, and this is all these visits were medically unnecessary. The first day of trial, their first witness, their quote unquote expert, who by the way was not a coder or a
They
biller,
they
just an
said
expert.
that your treatment was medically unnecessary.
They said that well, no, not the monoclonal antibodies for testing. These were all patients
Oh,
who got tested for COVID that they indicted me on, and they said that we had them see a provider, a nurse practitioner or a PA, and they said that was medically unnecessary. Sorry for the confusion.
well,
So
okay,
the first day of trial,
but the PCR testing that they were testing everybody for COVID was unnecessary. Do I have that right?
no, that they said what was unnecessary was for us to have them see a provider. So the patient would come into our urgent care center, and a nurse practitioner or PA would evaluate them and say, okay, I think you should have a COVID test done, or I think you should have a chest x-ray, or I think you should have whatever it is. They were the ones that decided what the treatment option was. So the government said that was medically unnecessary, alleged, excuse me. The Biden Department of Justice alleged that. On day one of trial, their expert, who's not a biller or a coder, but a quote expert on Medicare, testified under oath that one, time is irrelevant in direct opposition to what they indicted me for, criminal indictment. And number two, that all of these things were in fact medically necessary based on what CMS, which is Medicare, the FDA, the CDC, and everyone else put out saying that everybody should see a provider. So their own expert undermined their entire indictment of me under oath. Under oath.
So,
So,
so basically,
okay.
they told you to do something. You followed what they said, and then they told you
Yeah,
were wrong.
correct. It gets worse. It gets worse. So you raised a point before. How could the jury have found me guilty? So closing arguments come, and literally the government had gotten destroyed. Okay, completely destroyed. Every one of their arguments. Again, Those two that I just said, their own expert testified and undermined them. So it's coming to closing arguments. They have nothing. They presented no evidence. And in a criminal case, you have to prove two things. You have to prove intent, that you intended to commit a crime, and you have to prove that a crime actually committed. They couldn't prove that a crime actually was committed because the only person who testified about the billing, the actual billing, we had an expert come in who was the past president of the American Association of Professional Coders. And he looked at hundreds of charts, not just 5 charts. And this is what this man does for a living. And he said, yeah, the charts were all coded properly. Yet the government didn't even go to the expense of having a professional look at the charts. They just had government lawyers who know diddly squat about coding and billing. And they said, oh, yeah, your coding is wrong. Well, what the hell does the government lawyer know about coding when there are people who do this for a living? Anyway, so the closing arguments, and something that really bothers me about our system of justice, and I'm assuming it's the same in Canada, is the defense goes first, then the prosecution and closing arguments, and then the prosecution gets to rebut you. They get to go last. I'm like, they're the ones bringing the case. Why should they get to go last? That's crazy. But
Yes.
anyway, at least in a federal case, they get to go last. So they had no evidence. They had nothing. And by the way, to prove my criminal intent, they put up my tax returns, and they said, and the business's tax returns, and they just pointed to it and said, look how much money he made during COVID. He must be a criminal. I mean,
What?
literally, that's what they did. That's what they did. And I didn't even make that much money. But regardless, they said, look what he made before COVID and look what he made during COVID. He's got to be criminal. There's got to be something there. And I was just mystified. I'm like, how is anybody buying this ridiculous nonsense? And I don't think that they were. But then when it came time for closing, the government rebuttal, the chief prosecutor gets up there and he says to the jury, he goes, you may be asking yourself a question. What's the appropriate coding level? Is it a level 5, a level 4, a level 3, a level 2? The good news is you don't need to know. You just need to know that he's a criminal and he's wrong, meaning me. And then, even more mystifying, he gets up there and he says, you know, jurors, the defense, they had this expert come in and he put up all these charts and he talked about all these rules and all these things you had to follow. Just use your common sense. Does any of that make common sense to you? I swear to you, that's what he said. He goes, does any of that make common sense to you? And I think that resonated with the jurors because you know what? He's right. It doesn't make any common sense, but neither does filing your tax return, right? Like none of the government, nothing government makes common sense. That's not how it works. So they basically said, we write these rules. We want you to follow them. You follow the rules. And they said, oh, we didn't want you to follow the rules. You should use your common sense. So the jury votes to convict me, and then the judge, thank God, was paying attention, and he issues this 93-page opinion, which is right here.
Yeah, I
Um,
looked at it.
it's unbelievable, right? I mean, he tore the government apart, and he basically said they should never have brought this case in the first place. And I mean, I just want to read a couple of my favorite quotes, if that's okay with you.
Sure,
I highlighted
sure.
them because it's
Yeah, no worries. Go ahead.
he's he said no. He said the government did not carry its burden, and no reasonable jury could have so concluded. In the face of a jury conviction, by the way. Um, the evidence weighs so heavily in favor of the defendant that it would be unjust to enter judgment against him. End quote. Um, there can, of course, be no crimes if the defendant complied with those rules. End quote. I mean, and it goes on and on and on. 93 pages of that. So I get acquitted. It's the happiest day of my life, and I'm ashamed to admit that because it's not the birth of my children or my wedding day. It's the date some stranger votes to or decides to issue 93 pages of document granting me my freedom, which is just insane, but that's what happened. And then literally weeks before Trump's about to be inaugurated, the Biden Department of Justice decides to stick it to me one more time, and they appeal it. So not only did Judge Berdar, the chief judge of the state of Maryland, by the way, who issued this 93-page opinion, acquit me of all charges, but he guaranteed me a new trial in case that the government appealed, which they did. So I'm now facing a new trial under the Trump administration, and I'm hoping that someone will look at this and be like, this is insane. It's already been adjudicated. There's no evidence here. Like, this is crazy. Why are we wasting time and taxpayer dollars and destroying this man's life? You know, when we don't have anything. And by the way, just to bolster my case, the American Medical Association, I am not a member of, but and I've never been a member of, but they came to my defense and they wrote an amicus brief, which is a friend of the court brief,
Hmm.
and they said The rules that the government is accusing me of breaking, I did not break. And that's remarkable because the AMA writes the rules. So the writer of the rules basically said, I know, right? I mean, you can't make this stuff up, man. You
I
just can't. You
no, I
can't make
know.
this up. It's just like fact is totally stranger than fiction. It's just mind-boggling. You're like, how can this be happening? But this is where I find myself.
This is a problem of where we're at. I just got to take a short break to play a commercial, but we'll come and talk about this on the other side because this is a problem, a huge problem that we're seeing going on. So we'll be right back after.
Ontario, co-founder of Mark37.com. I spent my career in Silicon Valley working for high-tech infrastructure companies, and I've witnessed firsthand the surveillance apparatus they've built. Most of you already know we're in a digital war right now, but are you really aware that we're trying to fight this war with the weapons and tools of the enemy? That Android or iPhone in your pocket? That MacBook or Windows laptop? It's a tracking device feeding everything you say and do to companies that want you under their control or eliminated entirely. Every text, call, location, even how long you pause on a post, they track it all and use complex algorithms to then use this data to manipulate your behavior. If you knew someone hacked your devices and was selling your data without your consent, you'd be furious and terrified. So why are you okay with these companies doing this to you right now? Here's what they don't want you to know. There is another way. At Mark37.com, we offer phones, laptops, tablets, and even basic flip phones, all running systems big tech can't access unless you explicitly give them access. And what's even better is you also don't need to sacrifice productivity. I'm one of thousands of geeks mobilized across this country, building tools and providing education and support to help you live anonymously online before they enforce digital ID. Go to mark37.com. Sign up for a free 30-minute digital privacy consultation. Join hundreds of thousands who have decided to stop feeding their data to companies actively working to enslave us. Take back your communications. Take back your data. And may God bless you on your journey.
Yes, and I got myself one of those phones because I live in communist Canada. And I mean, they're intruding on you every step of the way, and they're trying to get other companies to do so. So if you want to get a discount, use the promo code Karis, and you get 5% off. So yeah, go check it out if you want to keep your stuff private. Um, Kind of going back to what we were talking about beforehand, is that when I looked at your case, it was a recurring pattern that I saw, whether it be the criminal court, the civil court, the family court, the immigration court. They All of these are operating in the same type of ways, and you're watching. And in your case, the judge, thank God that you got a judge that was like absolutely not with what was being done. Is
Yeah.
in the normal course of action, you're watching this progression of the prosecution that's coming in, and you're seeing a weaponization, and a lot of the times the judges go along with it. And then if you don't have
Absolutely.
the public, like you were a public figure, which was also working in your favor, because if you got a bad judge and it was in it, you know, that nobody knew about it, and I watch these cases all the time, the outcomes come different. Because I know even with my case, I came and I whistle blew in Canada in 2020, like this, like early, like in the spring summer of 2020, I started going off the rails about the engineering controls because I knew for myself that if I did this, someone would die. In engineering, if somebody makes a mistake, someone's dead. It's not like a banker, oh, well, you lost some money, we can pay it back. If, John can't get
Right.
back to his family, too bad. And then you go to jail. They start asking questions. And I was like, no. But then the hammer came down. And then I watched every person that was doing this, the hammer came down. And then it seemed that every person who was helping people, the hammer came down. And I'm thinking to myself, this is madness. And then I see the same thing happening with your case, and it's infuriating to watch. I'm not going to lie. I just can't stand it.
It is, and it's life destroying and life altering. And I have four kids. I have a wife who's a physician, and it's completely destroyed our lives, like beyond. comprehension that most people just can't understand what that means. Just imagine finding a document that says the United States of America versus your name. I mean, it's like the scariest proposition in the world. And, and then every time you see a black car drive by, you're like, oh my God, is that the FBI coming to spy on me? Is that like literally like you don't want to leave your house. You don't want to pick up the phone. I couldn't sleep for 2.5 years. I couldn't eat anything. I was like a shell of my former self. And, Dale, what's remarkable is like, if this truly, again, as I said before, like the whole coding issue makes no sense. And because, first of all, I hope I convinced people of that. But even if I didn't, if you really believed that there was some coding issue, right? What would you do? You'd pick up the phone like any normal human being, and you would call and say, "Hello, we have a question about your billing. We don't understand what you're doing. Like, could you explain it to us?" That never happened. They never gave me that opportunity. They never even, again, had a professional coder look at any of these charts. Like, who would do that?
It-
I'm not Sherlock Holmes, but for God's sakes, like any reasonable investigator would be like, well, maybe we should have a professional look at these charts to see if they're actually like legitimate or not. But they never did that, and they never talked to my partners. They subpoenaed my Yahoo, my personal email account, but not my business account, where I used to talk to all the providers. Like again, I'm not a detective, but that seems like detective stuff 101, and they never did any of that.
but
It's just like, God.
you don't have to be a detective. Like, for example, I was talking to a doctor about a few months back about an infection, and there were some issues going on. And I began to talk to him about the type of questions that you would want to ask. I don't have to be a doctor. There's a certain logic path that you're going to
Oh,
follow
right.
to come to find out something. May not be experienced in that thing, but you understand certain types of things you're going to want to know. So when you're sitting down saying you're not a detective, but you understand the process of trying to find information to get to the right answer, right? And that should be common.
Absolutely. Yeah. I mean, it should be basic common sense. But again, like, as I said, if you are shopping, Dale, and you go to the, I don't know, Home Depot, and you're buying a piece of wood, and you check out and you think they might have overcharged you, do you like pick up the phone and call the federal government and say, hey, I want to start a case here? Or do you just say to the checkout person, I think you overcharged me?
Yeah, fix it.
Like, it's so simple, right? But that never happened. They never gave me that opportunity. Instead, they just came at me with a sledgehammer over 5 charts out of over 100,000 people that we saw, which gives me up to 50 years in jail over a $250 billing dispute. Like, this just is insane.
That's where it becomes extremely ridiculous because 5 out of over 100,000, like that's like 0.01%. Like, it's so
Right.
minuscule. So that falls in within a margin of error of just being an clerical error. Somebody made a mistake along the way, if that's the issue. Because if you're looking at something like fraud, you're going to see a much higher number in a much consistent pattern, right? This is what you're going to see. So when you're sitting down and saying 5 out of $100,000, even if they were dead wrong, let's just say they were absolutely dead wrong, but 5 out of 100,000 cases, you're nuts. Like, that's just not even worthwhile.
Correct. Correct. And the government didn't even go to the expense of having anybody, again, I keep beating this, I don't mean to beat a dead horse, but having a professional look at those charts. And then you would expect that if they're going to claim that all these charts were fraudulent and we were billing too high of a level, you would have had somebody go through thousands of charts to get a statistically significant number and say, you
It's
know what?
exactly it.
But they didn't even do that. They didn't
No,
even go to the expense of hiring somebody to do that. Like, it just boggles the mind how they can bring criminal charges and destroy people's lives and livelihoods. And they took my company from me and everything because they want to. Just because they want to.
I understand.
It's
I understand. They wipe you out financially because my business plan was to keep businesses open because I could use the proper engineering controls and reduce the risk so that people didn't have to use the shirts off their back. And I got destroyed for it. And I
Mhm.
get it. Like, I get it. When you're out of favor with the government, this happens. They destroy you.
Yep. And I can tell you, not to not to be ethnocentric here, but like this is the most un-American thing you can imagine. And I say that because we pride ourselves in the United States on freedom, on liberty, and taking away, using weaponizing the government to destroy somebody is the most un-American thing you can do. The most un-Canadian thing you can do too. I mean, I'll throw Canada in there also because you guys, I love Canada, and I think you guys are big liberty lovers too and freedom lovers. And unfortunately, what's been going on in Canada in the last 5 or 6 years has been horrible,
Oh
and
yes,
I, it's foreshadowing, I think, for a lot worse coming. But this is just the pinnacle of like awfulness when your own government is weaponized against you. And
yes.
if people are interested, there's more information on my website. It's www.dropthecase.com. There's more information. There's a give, send, go. If people can afford to give, I would very much appreciate it because this has nearly bankrupted my wife and I. Thank God my wife still works. She's a pediatric oncologist. She treats children with cancer. And
Hmm.
thank God that she still had a job because I couldn't work for almost 3 years. Um, and it's been tough getting back to work too. So, but again, there's more information on the website. There's all sorts of stuff, and people can reach out to me, and I'm happy to talk to them. But this happens, as you said before, that I'm not the only one. This happens
No,
to a lot of people.
this is specifically like with what my daughter was talking about at the intro of the show with the petition for redress of
Hmm.
grievances. This is exactly why we did this. Because what we're looking at here, the only place that can actually address this is Congress and the president. And this is why we put that in, because we had about 21 people and they all had judicial branch issues and government agency issues. And in all of the cases, the courts did not work as function. It was only the judge in your case that ended up being the last stop because the jury of your peers, they they felt they missed the bus. They just they did it wrong. And so you're seeing this systematic weaponization of the judiciary, which is now a politicization of it that needs to be checked. And this is why when she talked about the Article 4, Section 4, this is exactly what's happening. Because
Hmm.
when you start making people wipe them out financially, you put them in jail, people are being harmed as a result of this. You're talking about violence. You're talking about being like you're basically turning people into slaves because when you're spending millions of dollars wasting everything that you have on frivolous like made up charges, destroying your life, this is a huge problem. This is where you have to sit down and say, is the republic functioning the way that it's intended to? And it's not. Because if you're having this high prevalence of this happening and politicized cases like this, there's a huge problem and it needs to be fixed. And that's why this needs to get dealt with.
100%, absolutely. And the problem is there's no accountability. So, the prosecutors and the people in the Biden Department of Justice, like, they don't care. They just move on and they get promoted. I mean, it's all about W's and L's for them. And I'll tell you, there's a guy who signed my indictment, who signed my appeal, and who also signed all the subpoenas for all the Arctic frost people, all the congressmen and senators who they spied on, the United States congressmen, United States senators that got spied on. His name is Kenneth Polite. And guess what? He's no longer with the DOJ. He was in the Biden Department of Justice, and now he's some hotshot, you know, lawyer working at a big law firm making, $1,500 an hour. He doesn't care. There's no accountability for him. He brought this bogus case, destroyed my life, destroyed my wife's life, destroyed all four of my kids' lives. Doesn't care, and is making them, making mint right now. And and he just got subpoenaed to come talk to Jim Jordan's committee in the United States Congress because he subpoenaed sitting U.S. senators and U.S. congressmen's cell phone records without their knowledge. Same guy, um, but no accountability. What's going to happen to him? Nothing. Zero. So it's just like they destroy your life. And again, like I bring this point up again, like they destroyed my life. They went after President Trump, the most powerful man in the world. Don't think for a second out there to your listeners that they can't do this to you,
Of
because they
course they
can and they
will.
will. If they have any reason to, they certainly will. Like there's no reason for them not to. If they don't like you, they don't like what you have to say, they're going to come after you. And I would say that as a physician, this is especially scary because you want your doctor to be able to say, I don't really agree with this narrative. I don't really agree with what they're telling me. I think publicly we should be questioning things. Like that's a good thing. That's the scientific method. And what they're
Yes.
doing is the antithesis of that. And you want your doctor to be out there publicly questioning this stuff to make sure that what's happening to you as a citizen is appropriate and is medically sound. But all this is doing is making us scared to speak up. And I can guarantee you that the next time there's a pandemic, and of course there will be another one, whether it's planned or not, like there'll be another one. I mean, we're a globalized society, so there will be another pandemic. Um, what idiot would want to put themselves in a position like mine? Like who would speak out and who would want to step up and do the right thing? I could have hidden in my basement. I could have stayed home. I could have shut the urgent care down. I didn't have to do what I did, but I did. And I saved thousands and thousands and thousands of lives and hundreds of millions of dollars to the system, if not $1 billion, because of all the people that we saved and all the people we kept out of the hospital. Um, and yet they're coming after me for this chicken shit nonsense. It's so frustrating.
This is the whole point. When I look at the way that they came after people, no matter what they were doing, that were trying to help people, that were trying to do the right thing, and that were speaking up against the abuses, I have to come to the conclusion that there was an element of people in the government that wanted wrong to happen. And there were people who were profiting from it. Because this is the only logical conclusion when I look at this from start to finish and how people were targeted is that they wanted to destroy human lives. There's no other reasonable outcome because statistically speaking, this is impossible for this to happen of random happen chance in such a deliberate manner. It's impossible.
So to speak exactly to your point, Dale, remember back a little while ago, I was talking about when they shut the program down, the monoclonal antibody program. Okay. They said
Yes.
there was an Omicron surge. Okay. The government came out and said 70% was the threshold and that had reached the 70% threshold. I went on the news and I said that you're full of crap. You don't know what you're doing. You don't know what you're talking about, and you're wrong. And guess what? About a month later, they never apologized, but they admitted, oh, yeah, we were wrong. The prevalence of Omicron is not 70%. Guess what it was? 20, 20. Now they missed that by a 50%, 50 percentage points. They missed that by. Now, in my mind, two possibilities. One, just complete and utter idiocy and just stupidity, which is entirely possible, or two, nefarious intent. I guess the third possibility would be a mixture of those two. To your point that this had to have been done on purpose, because how can anybody make a mistake of that magnitude? And you're not talking about stupid people. I mean, I get the government doesn't work well, doesn't function well, but the people that were doing all this stuff were not stupid.
Yes.
So I think there had to be some nefarious intent there, and they wanted to shut this program down because it was working, because it was saving people's lives, and it was obviating the need to go out and get a vaccine shot because you didn't have to, because you could get cured. So I didn't need a vaccine when I could get cured. So I firmly believe that that's what happened.
Well, for me, when on my for with from looking at the engineering, this for me is where the intent lies because engineering's a funny science. When you see a formula, it's not conjecture, it's not speculation. It's something that they've tested to demonstrate that this is something that replicates something in the real world. Whether you bend the steel by destroy it, bend it, and test all the properties, so they come up so that when you design something, you can have this working. Same thing with the HVAC systems and so forth. So when I saw what they did, it was impossible for that to be by random happenstance. They took the efficiency away, so it was impossible to work. So they'd have to have paperwork. And so I asked for it, and the Freedom of Information request says the records that you requested do not exist. So I'm like, so somebody had to take something that worked and then broke it and said, here, use this. And it had to go through a whole chain of hands. And then I went back and I looked at the CDC, the NIH, the NIAD, and the Public Health Agency in Canada. They all deal with guidelines for BSL-4 labs that use engineering controls so that people don't die, right? So they had full awareness of this. And then the CDC put this out and then filtered it out to everywhere. And they used it here in Canada. And every person that came alongside this said, oh, this is okay? No. That's possible. In every
Right.
jurisdiction, no.
And why on earth would Pfizer say we can't release the information for 75 years?
Yes.
Like, why on earth would they ever say that? If their data was so compelling, why would they say we can't release it for 75 years? Obviously, because everyone who would have been harmed would be dead by that point. Otherwise, there's no rational explanation for why it's going to take 75 years for them to release that information. So, yes, there has to be some nefarious intent here. I mean, there's no other explanation for it. Just like there's no other explanation for why they came after me. Their bogus nonsense about this being a coding dispute just makes no sense. It just doesn't make any sense at all. Um, so the weaponization of government's real. There's actually a really great group of people called the Weaponization Watch. That's the name of the group, and that they have a website, weaponizationwatch.com. I would highly encourage people to go to their website and check it out, because this is what they do. They find cases just like mine and other people's, and they highlight them, and then they try to get people resources and help as much as they can, because this is a real thing and it's really happens. And again, like, I mean, I'm not a crazy lunatic. I was like a regular person. I was out there trying to do the best I could during a tough time, saving lives, and they
Yes.
came after me and they ruined my life. And they guarantee you they would do it to you and do it to anyone who's listening. So, like, you got to be prepared and you got to believe that this stuff happens, because it does. I'm telling you.
Yes. And this is something that people have to understand. Liberty is a funny thing. If you take liberty from one person, then you've taken it away from all, and everyone has privilege.
Yes,
And
it's a
this is
great
what
point.
people have
Yep.
to understand, because I can't have liberty if my neighbor doesn't have liberty. This is the way it works. And when government start doing these things, and people in position of power, if they're not checked, it will continue. There has to be accountability and consequences, and hard consequences, because when you're trusted in those positions as a public servant, you are given power that you're supposed to get from the people to do what's right. When you do wrong, they need the hammer needs to come down, and the example needs to be made so they don't do this again.
Yeah, the system is crazy. Like, I didn't even know. I mean, again, like, I had never thought about interacting with the criminal justice system. To me, it was like the farthest thing from my mind. So I didn't know how the grand jury, for example, works. I don't know about in Canada, but in the United States, it's you don't even know you're under investigation. They have a grand jury, it's secret, and the only one who gets to speak to the grand jury is the prosecutor. And he basically, or she, can say anything they want, because you can never see what they said. It's sealed. So, like, they could be lying through their teeth just to get an indictment against you. You have no recourse. You can't defend yourself. And clearly they created bogus nonsense because they didn't even understand their own rules that they came after me for, as evidenced by the fact that their own expert undermined their entire indictment under oath. So, like, that's the system that we have. They can just say whatever they want and get you indicted. Like, it's crazy, but they will ruin your life because they can, and it costs them nothing. It costs you your life, it costs you your livelihood, your savings, your house, everything. It costs them nothing. They get paid the same amount whether they destroy your life or not. And they don't really care. I don't know how these people can sleep at night, but they don't care.
Speaking of costs, how much did it cost you to go through all of this?
I don't even know, but multiple millions of dollars. I mean, I still owe my attorneys, probably more than my house is worth. Um, and I have a nice house. But my lawyers have been great. They recognize the fact that I'm innocent, I didn't do anything wrong, and that this is nonsense. And they basically have been, you know, they're in a big law firm. They're like, just pass when you can, what you can. And I pay them every single month, whatever I can afford to. I write them a check once a month, and I'll be paying them until the day I die. But I mean, they've been very gracious about it. But now I'm facing a new trial, which is going to be more than double what I already owe them, what I've already paid. Um, Again, they're not, a lot of lawyers would be like, well, you can't afford to pass, see you later. They didn't do that, and they've been very good about it. And I mean, I think they know that, again, I'm innocent, and I have been making an effort to pay them whatever I can every month. But it's like I pay them way more than my mortgage payment. Um, it's you can't blame them, right? They're doing the job; they should get paid. But these they're
Yes.
not they're not cheap. I mean, defense lawyers are ridiculously expensive, and the government has. lots and lots and lots of lawyers at their disposal that work on salary, and they don't really care.
Yeah.
So it's it's very unfair. The system is very lopsided and very unfair. And I'll tell you, after that experience, um, I went into I started working for a company in Maryland that went into prison, goes into prisons and jails and provides medical services to the inmates. County prisons and jails, not state or federal, but very eye opening. And I really, it was kind of one of those there, but the grace of God go I. I mean, I could have been one of those people in one of these facilities, and they all deserve to be treated with respect. They're all human beings. Most of them are not hardened criminals. Most of them are not, what you would expect, awful people. They were really nice, most of them, and very respectful and very appreciative. So I really, I really liked that job. It was great, and I really got to make a difference in a lot of people's lives, which was very nice. But there's a lot of people who get. I mean, I met one guy. He's like, again, this is not a federal issue, but people get tossed in jail for all sorts of stupid things. This guy was like, there was a raccoon on my front porch, and I shot it, and I live in the middle of the woods. My nearest next door neighbor's over a mile away. The next thing I know, the police throw me in jail because I discharged my firearm in a residential setting. Um, so he had to spend a night in jail for that. I mean, it's just crazy what we incarcerate people for.
Yes.
But anyway,
But some of this is federal issues, because when you start seeing people getting their constitutional rights taken away, every state judge has the U.S. Constitution, treaties, and federal laws binding based on Article 6, the Supremacy Clause. So when a
mhm.
state judge, allows somebody's rights to be violated under the U.S. Constitution, that becomes a federal issue. And when you're starting to do this, this is where the federal government is designed to come in. Like, the federal government is there. The purpose for them to there is that if one state is out of line, then somebody could go to the federal
Yeah,
government and get them to come back in line to the Constitution that they all agreed on. Because if you didn't agree with the Constitution, leave the Union, or don't join to
right.
begin with. But you had your chance, so you said, this is what we agreed to, and this is what we're going to do. But what we're seeing now is the federal government is turning a blind eye and allowing the states to do these types of things. And you're seeing, like, this is how this weaponization is working. Like, after dealing with COVID, I started to see, like, the trafficking issue, the court issues, everything. And I was just like, this is what I'm dealing with. And I see this on a regular basis. And that has to be rectified, because there's going to be no future for our children. I've got two daughters. My youngest daughter I haven't seen for 6 years because of me coming forward and got punished
Oh,
in unconscionable ways. And I'm like, this
terrible.
has to get dealt with. And they knew, for me, I got wiped out financially, so I learned the law. So I started to represent myself. And then they just continued to go down, because I was like, absolutely not. If you stole my house, I could walk away. But when you went with my kid, I was like, you need to kill me first,
Yeah,
right? I'm never going to
good
stop,
for you. Absolutely. No,
right?
it's horrible. And they know that, the punishment really is not necessarily the end result. It's the process. The process is
Yes,
the punishment. They drag you through this, and again, like in my case, they're dragging me through it again because, again, what do they care? It doesn't matter to them. They're getting paid the same amount. They know that they can make my life miserable. They will. Every chance they get, they make your life miserable because they can, and they doesn't matter. No consequences, no problem. They can just destroy you and destroy your life and destroy your family's life. They don't really care. Um, and they know that the process is the punishment. So whether you end up in jail or not, ultimately that's their goal, of course. But you know, along the way, they can make your life hell, and they do. And a lot of people, by the way, a lot of people look at people who plead guilty and say, "Oh, well, they must be guilty because they pled guilty."
no,
But it's actually the exact opposite. Most people plead guilty because they don't want to face what I've been facing. They can't afford it. The government, by the way, will threaten your family. They didn't do it in my case, but they did it with General Flynn. They threatened to
yes.
indict his son and I think his wife. Like, who does stuff like that? It's like the mafia.
Speaking
But
about
they did.
speaking about General Flynn, I interviewed him a couple of times, and my daughter met him and gave him actually my engineering report, and he spoke about it publicly. talked about it's a national security concern. But what happened with him, what he did, people don't really understand the magnitude of what he brought forward. When he talked about the stovepiping, what he talked about, what he saw in Afghanistan, that's exactly what they used in COVID across the board. If they implemented what he said, they would have never gotten this far if there was communication across them. And so I understand why they came after him, because this, what we're seeing now, wouldn't have been possible if he had implemented and had all of those different agencies communicating with each other. Because if you notice how they
Hmm.
isolated everything and they weren't doing things properly, even in your case, they wouldn't bring in experts, and they isolated their narrative from things that they should have done, because proper investigation would get the people to come in to look at this case to strengthen their case. But of course, if they actually brought those experts in, it would have destroyed their case because they don't have one to begin with.
Right.
And so
Right.
these are things that have to get rectified. So you said you have a trial coming up. So where is that? What's going on with that? Where's that at?
Well, it's a new trial, and it's been January of 2027. Um, so I'm trying my best to try to get in touch with somebody in the Trump Department of Justice who can look at this and again say, in the interest of justice, because that is the name of this department, um, we should drop this case. And this is ridiculous and without merit. And frankly, I should get an apology. But I look, I just want them to go away. But I would love an apology, and I would love them to just leave me alone and to let me go about my life.
Well, they should
Because
restitution.
that would be great too. But one thing at a time, like, yeah, I mean, it's again, they destroyed my business. We went from one urgent care before COVID with 6 employees to 8 facilities with over 300 employees, and they wrecked all of that. They destroyed it all. It's all gone. Um, and that was, I was very proud of that. We did a lot of good. We saved a lot of people's lives. We helped a lot of people. And look, I mean, to the point I made before about my tax returns, like, did I make some money during COVID? Of course I did. Like, we saw over 100,000 people. But the business made the money. I mean, I got paid a little bit as the medical director, and I got a portion of it as an owner. But like, I wasn't, I'm not driving a Ferrari. I drive a Hyundai, for God's sakes. My wife drives a beat up Subaru. So like, the government alleges that like, you're Tony Soprano with money coming out of like the hidden in like the
Yes.
in the ceiling. I'm like, I mean, come on, it's insane. um and again, most fraudsters, like, they get these people, they drive Bugattis, and they have big yachts, and they have buy new houses. We don't live high on the hog. I have 4 children. Like, I'm taking my kids to soccer practice and lacrosse and ice hockey and stuff like that. I mean, we're
Yes.
not taking lavish vacations and buying expensive stuff. Like, this is just insane. And I keep saying that, I'm sorry, but it's so mind-boggling, and it's so hard to wrap your head around. And I find it very cathartic to talk about it, because for the longest time, the lawyers tell you, don't say anything, don't talk to anybody. Yet the government's free to say whatever they want. They can put out all these press releases and call you a criminal and call you all these horrible names, and you can't say a word. Well, finally, I said to my lawyers, I'm like, you know what, I think it's time to fight back, and I'm going to start speaking up. So I did, and I'm very happy that I'm doing it.
Yes, and it is good that this needs a lot of exposure and a lot of sunlight for things to get dealt with. And so I know we're running up here on time, but if you can hang around just after this, because there's something I wanted to talk about that can probably help what's going on
Absolutely
with you.
happy to. Yeah, of course.
Just for your final 2 minutes, what do you want to say to people? What do you want to tell people?
First of all, thank you for listening to me rant and rave about this, but it's really an awful thing to go through, and to be the victim of. My only goal really was to try to save as many people as possible and do as much good as possible. I figured, like, as an emergency room doctor, now is your time to shine. Like, this is like, it doesn't get any better from a job perspective or a life perspective than there's a global pandemic, and this is what I'm trained to do. So, like, time to step up, time to do the right thing. And that's what I did, and I embraced it, and I jumped in with both feet. I mean, I didn't see my family for 2.5 years. I didn't, I was running around. I was doing everything I possibly could. And the thanks that I get is to get indicted. And by the way, I didn't mention this, but the governor of our state came and awarded me a citation personally. He showed up at one of our facilities, drove in, came in, shook my hand, and gave me a citation saying for all your bravery and hard work during COVID. The state legislature did the same thing, and I'm a registered Republican. I ran for state senate as a Republican, and Maryland is an overwhelmingly Democrat state. Despite the fact that most people in the Maryland state legislature are Democrat, the state legislature voted to give me an award as well, a citation. And the Maryland State Medical Society named me its person of the year even after I got indicted, which I think speaks to just the work I was doing during COVID. So people jump to conclusions when they see things. The government puts out these press releases, and please just don't jump to conclusions because you don't have all the facts. I can guarantee you that. And if you can please go to my website, dropthecase.com, I would very much appreciate it. And if you can afford to give something, just please go to the Give Send Go. It's on there, and follow me on X, Ron Elfenbein MD. And I'm happy to engage with people. I'm happy to talk about it. I'm happy to, share stories, whatever. But as you said, Dale, like this happens to one person, it happens to everybody. So this is something we need to put an end to.
Absolutely. And, I mean, before we go, I'm going to close here with a prayer because we need some of this. And this needs to stop. People need to understand that you cannot allow this to happen to anybody because it will happen. And so with that, I'll close. Heavenly Father, Lord, we thank you for this day. We thank you for your love, grace, and mercy. And Lord, the hope that you've given all of us. And Lord, we look at the situation. I ask if you to intervene and watch over Dr. Ron with his situation and all the other people who are fighting the weaponization of the government, and help that people will come together to stand up against this, and that the men and the women will come together, rebuild our families, our churches, our community, our nation, that we can have some protection for the children who need it the most is my prayer in Jesus' name. Amen.
Amen.
All right.
Thank you.
Thank you guys all for